Now let's get into the real deal. Taking a sample to determine the acid-base disorder is called an ABG, or arterial blood gas. Normally, when we take a blood sample, we take it from the venous system. But to determine the acid-base status, we take it from the artery, usually the radial artery. And you're probably wondering why. Well, it's because we need to know the carbon dioxide level before it has gone to the tissues. So from the arterial blood, we see the pH, which should be between 7.35 to 7.45, the bicarb level, which should be between 20 to 28 millijoule per liter, the partial pressure of carbon dioxide, which should be between 35 to 45 millimeter mercury. Let's quickly go over some definitions. Now, acidosis or alkalosis refers to the disorder altering the hydrogen ion levels, while acidemia or alkalemia refers to the presence of high or low pH in the blood. So someone can have acidosis without acidemia if there is a mixed disorder. So the terms are different and mean different things, and it's best you understand the difference now. Now let's go into the disorders. So the four main types of acid-base disorders are as follows: respiratory acidosis, respiratory alkalosis, metabolic acidosis, and metabolic alkalosis. So there are many ways to approach an acid-base problem. And there are many ways to look at an ABG and try to figure out what sort of acid-base problem there is. But we have tried to find the easiest way to do that for you. So first, we'll check the pH. Is it less than 7.35? That's acidosis. Is it more than 7.45? That would be alkalosis. Next, we're going to check the bicarb and partial pressure of carbon dioxide. Normally, the bicarb level is between 20 to 28 millijoule per liter. And partial pressure of carbon dioxide from the ABG is normally between 35 to 45 millimeter mercury. And then all you have to do is determine the acid-base disorder. So let's do this using the equation. So if there is a low pH and low bicarb level, we're looking at a metabolic acidosis. If we have acidosis and an increase in partial pressure of carbon dioxide, we're looking at a respiratory acidosis. If we have an alkalosis and an increase in bicarb levels, we're looking at a metabolic alkalosis. And if we have an alkalosis and a decreased partial pressure of carbon dioxide, we're looking at respiratory alkalosis. Now, after all that, when you know what disorder is, in metabolic acidosis only, you have to see if there is an anion gap, which we will talk about in detail in the metabolic acidosis video. And lastly, we use these special formulas to check for any mixed disorders, which is basically talking about if you have combined respiratory and metabolic disorder, or you may even have two metabolic disorders at the same time, which we will look into in the next section. Now let's even make it more simple. What is the acid-base disorder? And is there a secondary disorder? The way to check this is to determine whether the compensation is appropriate. So keep watching to learn about the most important bit of an acid-base disorder approach.